In the core ages, the world of dental therapy was far from the subtle procedures we all know today. Dentistry, as a formalized scientific practice, used to be not but headquartered, and the working out of oral well-being used to be rudimentary. At best, most humans lived in a time when the reasons of toothaches, infections, and dental issues had been poorly understood. The inspiration of germs and bacteria was once unknown, and the idea of anesthesia or antibiotics used to be centuries far away from being discovered. Yet, regardless of these obstacles, members in the center, while nonetheless needed to deal with the basic problems of tooth pain and oral care. Nearly all of dental treatments during this time were frequently rudimentary and carried out via men and women with little formal scientific training. These individuals had been most likely not what we would call dentists at present, but were most likely barbers, blacksmiths, or other tradespeople who were the closest factor to a medical practitioner of their communities. Barbers, in specified, had been known for performing a sort of tasks, including haircuts, shaving, and the occasional dental extraction. These practitioners had been known as barber surgeons. They had some general advantage of tips on how to care for fashioned illnesses, together with tooth extractions. However, their education was once minimal in comparison with the standards of modern-day medicine. Tooth extractions were usual within the medieval period, and so they had been by and large the go-to answer for any enamel-related problem, especially if there used to be an obvious contamination or severe decay. People of all a long time, from young children to the elderly, underwent enamel extractions that have been carried out without the aid of painkillers. These extractions have been regularly carried out speedily and without a lot take care of. The patient's remedy. The tools used for extractions were simple and unsophisticated pliers or forceps, which have been by and large made from iron and looked very like the instruments used by blacksmiths. These crude devices were, as a rule, sterilized by heating them in fireplace, although sterilization was once an unknown inspiration, and infections were original later on. The inspiration of treating toothache past extraction used to be now not usual in the middle a while. A lack of expertise about oral hygiene meant that many folks didn't take steps to hinder enamel decay or different oral problems. Folks of all lessons, from peasants to royalty, had poor dental care. Even though the elite might have enough money to have their tooth pulled by using any person who used to be probably more skilled than the average man or woman, correctly, a few of the rich participants in medieval society, together with royalty, mostly had their enamel extracted with no trouble, given that they did not need to care for the affliction or the skills. Embarrassment of getting obvious decay. For many, who could not find the money for extractions, the alternative used to be to live with the agony. There were some rudimentary residence treatments that have been believed to support alleviate toothaches. These integrated swishing with more than a few concoctions, reminiscent of vinegar or salt water, or applying herbs directly to the affected field. Some medieval humans also believed within the healing energy of certain stones or crystals, which they would position of their mouths, hoping for comfort. Nevertheless, these cures had been largely ineffective, and toothaches remained a customary anguish. The treatment of dental infections was yet another area the place medieval capabilities was once lacking. Without antibiotics or any type of understanding of infection management, there was little that might be completed to avert or treat infections when they set in. Correctly, many individuals who had dental problems also suffered from severe gum disorder and abscesses. These conditions had been more often than not left untreated until they became unbearable, at which factor the contaminated tooth would easily be removed. In addition to the extraction of enamel, medieval practitioners additionally engaged in different, more bizarre dental practices. Some would place crude steel or wood fillings in decayed enamel, though these cures weren't usual. As a rule, teeth had been either extracted or left to decay naturally. For individuals who suffered from the lack of tooth, the only alternative was once, quite often, to simply live without them. False enamel had been rare and hyperized, and the thought of replacing enamel with synthetic materials was not yet realized in any fashionable manner. Hence, the apply of dental care in the core ages used to be rooted in practicality, but used to be severely confined by the lack of scientific competencies and technological advances. The prevailing scientific view of the time didn't completely admire the value of oral wellness, and individuals needed to undergo the consequences of enamel loss and ache in a way that seems impossible to us in these days. But, Regardless of the challenges, individuals discovered ways to control, with restrained resources and knowledge, the hardships of dental afflictions. As we can see, this practice would evolve in the centuries that followed. However, for now, medieval persons had been left to face the anguish of their tooth without the help of the contemporary advancements we now take without any consideration. Dental extractions, in the core a long time, have been some distance from the sterile, managed strategies we experience today. For many persons, the ride to a dentist, the event you would even name them, that was now not an alternative, but as an alternative, a necessity driven through unbearable pain or visible illness. It was a time when enamel loss used to be an expected part of life, and those that were fortunate sufficient to retain their tooth well into maturity were considered fortunate. There have been no painkillers, no anesthetics, and no antibiotics to ease the approach. The system was usually implemented with little greater than the fingers of a barbershop health practitioner and the heat of a makeshift instrument. The first step within the extraction approach was once, as a rule, the diagnosis. This used to be more commonly executed by using the regional barber general practitioner, or in a similar fashion, unqualified man or woman who had learned their craft via experience rather than formal education. They would normally examine the sufferer's tooth by way of hand, often even probing the affected field with their fingers or simple tools to determine whether extraction was once vital. Enamel decay or a swollen, painful gum have been usual reasons for such an examination. As soon as the choice was made that the tooth had to be removed, the system was once carried out right away, generally with no more education than a short warning in regards to the upcoming suffering. In the absence of anesthesia, the patient would have got to endure the process with little to ease their discomfort. Some reports advise that alcohol was once generally used to numb the patient or calm their nerves, but this was once neither guaranteed to be powerful nor universally to be had. For those who have been fortunate enough to receive any type of sedation, it was once typically rudimentary, unsatisfactory, and offered little remedy. The reality was that tooth extractions in the core ages were excruciating experiences. The tools used for extractions had been, by way of today's specifications, crude and unsophisticated. The most, more often than not, used devices had been forceps, similar to massive steel pliers. These pliers would be inserted into the patient's mouth and used to grip the tooth tightly. With a series of tugs and twists, the enamel can be pulled from its socket, in most cases with quality concern. The extraction process used to be quick, however the drive required made it far from tender. Many patients said, listening to the sickening sound of their tooth being wrenched free from their gums, which brought to the trauma of the procedure. The extraction itself was once not without its risks. Infections were fashioned due to the unsanitary conditions below which these approaches had been performed. Tools used for extractions had been hardly ever sterilized, and any wound left behind was susceptible to illness. In a while, there have been no antibiotics to hinder the spread of bacteria, and plenty of persons who underwent extractions suffered from painful infections that might result in more severe health complications. However, given the shortage of expertise about germs and infections, the hazards of the system weren't entirely understood. For many who had multiple teeth eliminated, the healing procedure was slow and painful. The mouth would almost always swell, and consuming or drinking became an intricate challenge. For many, the one remedy came from common cures, which incorporated swishing with herbal concoctions or inserting poultices created from vegetation known for his or her medicinal houses. Some men and women would turn to devout figures or local healers for additional relief, because it was once believed that spiritual intervention could support within the remedy procedure. The incapacity to manipulate affliction throughout these extractions almost always led to a high degree of fear and anxiousness surrounding the system. For a lot of participants, the mere concept of traveling the neighborhood barber surgeon to have a enamel removed could reason an excellent deal of misery. Even folks who had passed through the system prior to now weren't resistant to the worry of having to repeat it. It was once not exotic for participants to wait unless the ache grew to become unbearable before seeking medication, which made the extractions all of the more tense. In some circumstances, patients would even attempt to extract their own tooth at dwelling, utilizing tools they'd customary themselves, or the help of a friend or family member, although this was once continually a dicey pastime. Regardless of the worry and ache related to these extractions, there were some who, out of necessity, had learned to suffer the method. As dental extractions were visible as a part of life, many people in medieval society had grown familiar with the agony and aftermath of the procedure. The fact that enamel extractions were a preferred observed during societies, starting from peasants to royalty, illustrates just how common dental disorders were during this time. It used to be a shared expertise that, regardless of its painful nature, did not carry the stigma it might today. In a technique, it used to be simply one other part of everyday existence, and those that sought therapy did so with the working out that it used to be, more often than not, the only way to rid themselves of the ache. The dearth of brand new technological know-how or understanding of oral well-being, nonetheless, made dental care a frightening and disheartening facet of medieval existence. But, for many who underwent extractions, there was little choice but to take delivery of the practice as part of their existence. Toothaches were a constant companion, and for many, the answer was not to repair or restore, but comfortably to do away with. This apply would persist for a long time to come, with little exchange until the appearance of latest dentistry, which would slowly become the way individuals viewed and dealt with their enamel. Regardless of the well-known use of tooth extractions, the medieval world was once not totally without makes an attempt at dental care past the elimination of enamel. Whilst the general populace did not have entry to the developed instruments or techniques we now companion with modern-day dentistry, there were nonetheless some efforts made to ease toothaches or prevent decay. Nonetheless, these ways had been generally established on trial and mistake. They usually had been rooted within the traditional beliefs of the time, which most likely combined practical remedies with superstition. Herbal therapies had been probably the most fashioned type of alternative dental care. Vegetation and herbs have long been used in remedy for his or her supposed healing homes, and within the core a long time, this used to be no specific. A few of these remedies have been passed down through generations, whilst others were recommended by local healers or herbalists. Despite the lack of scientific working out of how these herbs worked, many humans believed in their effectiveness. These remedies have been viewed safer, although generally no more robust than teeth extractions in curing the underlying reasons of dental pain. One of the vital most often used herbs for enamel suffering was clove, identified for its numbing. Holmes' clove oil was once normally applied directly to the gums to alleviate the soreness of a toothache. Whilst this would provide temporary alleviation, it did little to deal with the basis intent of the enamel decay or contamination. Some medieval texts even endorsed chewing cloves to restrict dangerous breath and maintain healthful toothspeed, even though this was once centered on belief, alternatively than evidence. Other herbs used to treat dental disorders included sage, rosemary, and peppermint. These have been more often than not utilized in mouthwashes or as constituents in poultices, utilized to the affected field. Using salt used to be additionally customary for the period of this time. Saltwater rinses were believed to cleanse the mouth and minimize swelling induced by gum infections. While salt water may indeed have some valuable results, notably in terms of soothing inflammation, it used to be a ways from a healing for the more critical dental problems of the interval. Some humans also grew to become too vinegar, either as a rinse or as an ingredient in a salve, hoping that its acidic homes would cleanse the mouth and preserve in opposition to further decay. However, the ignorance about the nature of dental decay meant that these treatments have been mostly ineffective. Furthermore, to herbs there have been countless superstitions surrounding dental health. Men and women in the core a long time frequently grew to become too magical or devout beliefs to explain or therapy their teeth troubles. For instance, some believed that precise stones or crystals might medication toothaches or prevent decay. These beliefs have been rooted in the suggestion that these objects had mystical therapy powers. Using amulets or charms to safeguard tooth was no longer distinct. Individuals would wear or lift these objects with the hope that they'd thrust back dental discomfort and health problem. It used to be also believed that unique saints had the vigor to heal dental problems, and prayers to these saints were a common part of the dental care events for a lot of individuals. The belief within the healing vigor of saints also increased. To the concept of miracles, some men and women would visit shrines or relics believed to own divine vigor, hoping that they'd receive a striking healing for his or her dental illnesses. Even as these practices have been not going to furnish any genuine alleviation from the suffering of a toothache, they furnished relief and hope to the stricken. These religious and magical tactics to dental care had been fashionable and now not restricted to anybody classification. Men and women from all walks of lifestyles, from peasants to royalty, typically resorted to those superstitions and rituals as a technique to manage with the discomfort and uncertainty of their dental problems. Regardless of the popular use of those natural and magical therapies, it is primary to notice that they were not universally authorized. Many folks in the core ages, notably these with access to more formal hospital therapy, saw these practices as superstitions or pointless. However, for the majority of the populace, these cures supplied a semblance of relief, even if they did not normally provide the preferred results. Within the absence of powerful clinical therapy, these herbal and magical options grew to be an primary part of daily existence. As we appear at the dental practices of the middle a long time, it is clear that the interval used to be characterized via a lack of expertise of the authentic explanations of dental issues and the satisfactory methods to treat them. Whilst natural cures and superstitions can have furnished some transitority alleviation, they have been a ways from mighty solutions to the extra serious dental problems of the time. The sector of medieval dentistry was once one the place agony, was once mostly persisted, and the probabilities for therapy have been confined to the tools and beliefs of the generation. Only with the passage of time and the gradual development of scientific science would dental care to evolve into whatever, more potent and refined. The practice of dental care in the core ages, principally in terms of teeth extractions, was once now not handiest formed via the limitations of clinical talents, but additionally by using the social constitution of the time. In medieval society, access to hospital therapy, together with dental therapy, used to be most often determined by using one's social class and wealth. For many, dental care was once a luxurious something that would simplest be afforded by way of the rich and robust. For others, primarily the negative, enamel extractions had been most of the time carried out as a last resort. When affliction grew to be unbearable, they usually had been left to endure the leisure of their dental issues without recourse. For the aristocracy and royalty, dental care used to be treated moderately otherwise. At the same time, they too had to deal with teeth decay and dental discomfort. They have been a long way extra likely to have entry to a barber healthcare professional or a knowledgeable professional who would participate in enamel extractions, though these participants frequently nonetheless lacked formal coaching in dentistry. The wealthy might have the funds to have their enamel attended to extra in most cases, and they will have even been able to come up with the money for the luxury of getting their extractions carried out with extra care. Although without the relief of anesthesia, even the richest individuals could no longer break out the ache of a tooth extraction. Nevertheless, even the nobility did not fully escape the lack of potent dental care. Many royal families and rich members suffered from enamel loss and negative oral hygiene, as the working out of dental well-being was still rudimentary. The change for the upper lessons used to be that they most often had extra resources to handle the consequences of enamel loss, together with the ability to switch lacking tooth. This was once a gigantic abilities that the bad did not have. It's principal to notice that, despite their wealth, many medieval royals and nobility suffered from dental problems just like those of their poorer subjects. Some royal photos from the interval expose the signs of enamel loss or decay, illustrating that dental health used to be a common obstacle. In spite of fame, at the same time the rich would come up with the money for some type of dental care. The negative had been quite often left to their own contraptions. Nearly all of humans, particularly peasants and decreased category workers, had little choice, however, to undergo their dental agony with non-intervention. For these members, the cost of a talk over with to a barber medical professional was as a rule too excessive, and the procedure itself, if they could have the funds for it, was painful and scary. The poor generally had restrained access to any type of hospital therapy, let by myself dental care, and this used to be reflected in the state of their teeth. Many peasants, mainly in rural areas, did not have the posh of searching for dental treatment in any respect. For them, toothaches and decayed enamel had been with no trouble a part of lifestyles. They usually commonly had to rely on people, cures, devout practices, or the occasional self-extraction to alleviate their suffering. The divide between the dental care to be had, to the wealthy and the bad, was once not only a reflection of economic inequality, but additionally a reflection of the broader social and scientific inequalities of the center a long time. the wealthy could manage to pay for to maintain their health and remedy, even as the bad in most cases had to make do with what little that they had. This discrepancy in entry to dental care serves as a microcosm of the greater gaps in hospital treatment throughout the medieval interval, the place the rich had been capable to obtain more developed and prevalent cures. At the same time, the bad were left to suffer without the improvement of suitable scientific awareness. It's also valued at noting that the social stigma surrounding tooth loss was one of a kind for the rich than it was for the negative. For the rich, the lack of a teeth was ordinarily visible as a signal of getting older, but not necessarily something to be ashamed of. There have been no brand new beauty issues about missing teeth in the medieval period, and actually, it was once relatively common for members, in spite of repute, to lose tooth as they aged. For the curb courses, nevertheless, missing teeth could elevate a more significant social stigma. Enamel loss, especially in more youthful participants, could indicate terrible well-being or a lack of private care, and this could lead to social marginalization. This, in flip, made the tooth extraction method much more distressing for the minimized lessons, who had fewer resources to deal with their dental problems and usually suffered from the social penalties of teeth loss. In the context of dental care, medieval society was once mostly shaped with the aid of type distinctions. The rich had entry to the exceptional care they would manage to pay for, although this used to be nonetheless limited through the shortage of advanced clinical understanding. The bad, alternatively, ordinarily had to undergo their dental afflictions in silence, with little hope of remedy. These social divisions would continue to form medical maintained centuries to come back, and it will be a while earlier than the advancements in dental care can be made available to all participants of society, despite wealth or classification. The core, a long time, marked a time when dentistry was nonetheless a primitive apply, governed by means of superstition, rudimentary instruments, and a scarcity of scientific figuring out. Nonetheless, this interval used to be also the starting of the gradual evolution towards extra-developed and systematic dental care, even though huge development would no longer occur unless a lot later. The seeds of modern dentistry have been sown within the medieval era environment, the stage for the breakthroughs that will comply with in the Renaissance and beyond. One of the foremost points of this devolution was once the eventual consciousness that dental health was a topic of clinical situation and not just a cosmetic quandary. As remedies started to improve extra systematically, there was once a sluggish shift in attitudes towards oral care. In medieval occasions, dental issues have been regularly treated as a secondary concern, with far more emphasis positioned on different scientific problems. Nevertheless, as the figuring out of anatomy and the human physique advanced, dental care began to be recognized as an extra principal part of total well-being. This shift would lay the groundwork for the eventual development of dentistry as a well-known medical career as we transition from the medieval period into the Renaissance. The impact of classical abilities started to resurface. Historic Greek and Roman texts on treatment, which had been largely neglected for the period of the early center, a long time, have been rediscovered and translated. These texts integrated early observations on the anatomy of the mouth and tooth. As good as some rudimentary dental practices, this revival of classical studying helped foster a renewed curiosity in understanding human health and anatomy, which would finally make contributions to the progress of extra-refined dental strategies. During this time, dental care started to maneuver past the crude extractions and natural remedies that had characterized medieval dentistry. Using more evolved instruments slowly emerged, and the primary forms of rudimentary dental instruments, comparable to forceps and dental drills, started to be sophisticated. These devices have been nonetheless far from the precision tools used today. However, they represented a giant growth over the pliers and makeshift instruments of the previous era. However, it was no longer until the 18th and 19th centuries that real advancements in dental care would take place. With the introduction of anesthesia, better surgical tactics, and a developing understanding of dental hygiene. The introduction of anesthesia within the mid-19th century was once a recreation changer for dentistry. For the primary time, sufferers would bear dental techniques without the intense soreness and trauma that had been a trademark of dental handle centuries. This progress, together with the invention of antiseptics and the observe of sterilizing instruments, cleared the path for the more developed and humane dental approaches that we are familiar with in these days. the subject of dentistry started out to professionalize, with dental faculties being centered and specialized dental practitioners emerging. Regardless of these developments, it's fundamental to recall that the legacy of medieval dental practices still lingers in contemporary occasions, while the tools, systems, and figuring out of dental care have vastly increased. Many of the common standards, such because the significance of keeping oral hygiene to prevent decay, have been first recognized during the medieval interval. It's within the gradual accumulation of skills, from using herbal remedies to the eventual progress of anesthesia and modern instruments, that we see the long and winding avenue toward the subtle dental practices we now take with no consideration. The history of dental cure in the Center Ages, then, is a story of battle and gradual development. While medieval individuals faced vast challenges in dealing with toothaches, infections, and different dental problems, they did so with the resources available to them. It is a testament to human perseverance and ingenuity that, regardless of the various obstacles they confronted, individuals in the core ages sought to alleviate their suffering and improve their fine of lifestyles. Over time, the gradual evolution of dental care would lead to the latest practices we know at present, changing the way we method oral well-being and medical care as a entire. In conclusion, the medieval generation stands as a pivotal factor within the historical past of dentistry. It used to be a time of both difficulty and discovery, where persons labored inside the limits of their talents to address the issues of oral wellness, from the crude extractions carried out by barbers to the use of natural cures and magical beliefs. The dental practices of the time may seem primitive with the aid of today's specifications, but they symbolize an ancient part of the story that resulted in the dental care we now revel in. The legacy of the center a long time isn't one of stagnation, but as a substitute, a sluggish and steady experience toward the dental practices which have shaped cutting-edge healthcare.